I'm going to be talking about stretch marks, why people have stretch marks, and what it is that you can do about those stretch marks that you already have on the skin. Hey guys, welcome back to my channel. I am Nursekelly. I create content around nurses, aesthetics, skincare and lifestyle. Let's get right into this video. So what are stretch marks? So stretch marks are actually linear depressions on the skin. They can come as a result of a combination of hormones and overstretching of the skin that can lead to loss of elastic fiber. They are also common in pregnant women, people who suddenly gain weight, or people who suddenly lose weight. Sometimes in bodybuilders, people who are trying to bulk up muscles on the shoulders. You can tend to see stretch marks in those people. These are common ways in which stretch marks can actually result. There are essentially two types of stretch marks seen in most individuals. You have the striae alba and the striae rubra. The striae rubra, they are dark in darker skin types. You can see them as reddish in some other skin types, or sometimes the color can be purple in another skin type. Usually the best way to treat stretch marks is as soon as they occur. So once you notice that stretch mark on the skin, try as early as at that time to start treating it. Don't wait till about 2 years, 3 years, because the improvement is not really that much. Stretch marks, the best time that they respond to treatment is usually within that period of time that you have it. So with the striae rubra, they actually respond faster to treatment, because when you see a stretch mark that is reddish in color, that means it's vascularized. They have red blood vessels in it and they respond faster to treatment. But those red color type of stretch marks can easily become the white ones in the next few months or in the next couple of years. With the striae alba, they are whitish in color, and that means that there are no longer blood vessels in it and they don't respond as fast, or they're not usually responsive to treatments. However, stretch marks can actually respond to cosmetic treatments in the clinic or to topical products that you can use. But however, the improvement or disappearance of the stretch marks is very minimal. So it means that your kind of stretch mark may not respond depending on the body's area where you have the stretch mark. Some other people have stretch marks all over their body. I would usually advise that you start in lesser body areas and then try and see the improvement before you can start other parts of your body with large body area. Stretch marks can mostly be seen in more adolescent females than adolescent male. Studies have shown that 70% of females have more stretch marks than 40% of males. Now you can mostly see stretch marks in different parts of the body. You can see stretch marks on the breasts, you can see stretch marks on the upper arms, on the thighs, on the calf. You can see stretch mark on the abdomen, on the buttocks, on the lower back. These are the areas where you can see stretch marks. More specifically, you're going to be seeing stretch marks on areas that is prone to severe stretching of the skin. Those are areas with most likely chances of having loss of elasticity because of the constant loss of weight gain, weight loss and stretching of the skin. Some people may not go through some of these things but end up having stretch marks. For example, myself, I have 1 or 2 stretch marks on the body, but I did not severely lose weight or gain weight. I have always known myself to have stretch marks. So it can actually happen. With puberty and adolescent age, we tend to sometimes develop stretch marks, okay? So it is absolutely normal for you to see stretch marks in 1 or 2 areas of your body. However, if it's of a concern to you, then you can decide to actually go for cosmetic treatments. Now I'm going to mention a couple of cosmetic treatments and how they actually help to improve stretch marks. Like I said earlier, with stretch marks, the different types of stretch marks will determine how well they respond to treatment. So I would like to say this here today, that there is no cream that can significantly improve stretch marks. So what I'm going to mention here today, they are just things that people have actually mentioned that help to improve their stretch marks, and from my role as an aesthetic nurse, I have come to see that these things help one little way or the other to improve the appearance of stretch marks. Stretch marks cannot completely disappear. So you have moisturizers, right? With the moisturizer, you're looking at to lock in moisture into the skin to prevent water loss. So the more you help trap in moisture to the skin, the less chances that the stretch marks will become more obvious. You're also looking at topical retinols. Topical retinols like tretinols are actually great to cause skin cell turnover that would improve the appearance of the stretch marks. It can actually be used as a prep for the treatments that you're going to undertake. Topical retinols, what you should know is that it cannot be used when you're breastfeeding or you're pregnant. They actually cause skin cell turnover, so they help to rebuild collagen production, but in certain areas of the body they can cause irritation. So depending on where you have the stretch marks, retinols may not be used in certain areas. So you should actually confirm with your dermatologist, your aesthetic nurse, your esthetician on the best ways to use retinol in your treatment of stretch marks. Retinols, however, help to improve the red type of stretch marks compared to the white type of stretch marks, that's the striae alba. You don't really see a lot of improvements with the striae alba while using the retinol. Some people will complain that I've tried to use retinol before, that the different brands of retinol that is available here in this part of the world. So when you use them, the type of your stretch mark would also determine how drastic or dramatic the changes would be. And also, if you're locking in moisture, remember I talked about actually preventing water loss on the skin. So if you're using a moisturizer and how you are doing the retinol, the type of stretch mark that you have will determine if you would actually see any improvements with your stretch marks. So there's also laser therapy. So what laser does is to stimulate cell regeneration. Now you notice in certain people it would help to actually reduce the appearance of the stretch mark a little and help smoothing it. It does not, however, completely remove the stretch marks. Depending on how early you started your treatment of stretch marks and the type of stretch marks that you have, it would also determine the improvements. I would encourage that you do a patch test. If you have stretch marks all over your body, you should actually start with a patch test on the smaller areas of your body and then see if you have any improvements before you decide how many sessions of laser therapy that you're going to need for your stretch marks. With laser therapy, there are different types of lasers, and some lasers are recommended by the FDA to be used to actually improve stretch marks. You have the fractional laser. With the fractional laser, you have a specific type of fractional laser that is being recommended to improve stretch marks. Icon 154 fractional laser. This laser has been approved and is being used in the treatment of stretch marks. However, I don't really know the type of stretch marks that you may have while watching this video, so I would like you to actually book with your esthetician, your dermatologist, and aesthetic nurses to find out what exactly you need and the type of laser that you need. Fractional lasers have been known to actually improve stretch marks. IPLs are also great, but the type of stretch marks that you have will determine if you need to use the IPLs. There's also the pulse laser, but these type of lasers, they are actually great when you have stretch marks in the beginning parts, like the early stages of your stretch marks, and when you actually have the striae alba, that's the ones that have already turned white. I have microneedling as a form of treatment therapy. Microneedling stimulates collagen production, and with stimulating collagen production, you are just trying to build up the elastic fiber of the skin just to reduce the appearance of the stretch mark and to smoothen it a little. Some other people also combine microinfusion, rich plasma protein into it just to help stimulate collagen production. So you can see some people combine rich plasma protein and microneedling or microneedling alone. So this, however, with all these treatments, most important thing you need to know should be that it does not completely disappear. So the improvements rather can be 60%, it can be 50%, it can be 70%, depending on how early you started the treatment and the type of stretch marks that you have. You should also note that when you use steroid-laced creams, they actually predispose you faster to stretch marks. Most people use steroids. Sometimes you're being prescribed steroids to use for a short period of time, and then you end up using it for a longer period of time than that is actually not recommended. You tend to develop stretch marks. So that's one of the side effects of using a steroid. You also see them in people that use organic creams. In this part of the world, we have what we call organic creams, people that mix products, not usually qualified practitioners, and they mix it and then sell to people to use, over time those individuals tend to develop stretch marks. All right, so that's another major cause of why people have stretch marks these days. I'm going to actually talk about the general measures you're going to take to avoid developing more stretch marks. Fall into the category of people that have used steroid-laced creams and you're beginning to see stretch mark on the body. The first advice I would actually give you is to stop those steroid-laced creams. Because the more you move from one cream to another, you see on the internet that a lot of people are advertising for creams that help to cure stretch marks, creams that do this, the creams that do wonders on the skin. But I would really advise that you stay away from those things, because the more you use those creams, the more the stretch marks actually becomes worse. There is no cream that can cure stretch marks. There is no one cream that can totally make your stretch marks to disappear. What you're just doing is to move from one steroid to another steroid, and the stretch marks begins to develop and becomes this striae alba. Looks way worse than the original way you actually saw the stretch marks. So the first precautionary measure is to actually stop. If you're using those steroid creams, please stop. The second way would be to actually use moisturizers. Like I said earlier, to lock in your skin with a lot of moisture. Emollients, humectants, occlusives help to lock in moisture to the skin so that to prevent transepidermal water loss. You're also going to have, studies have also shown that vitamin E, almond, they don't really do so much, even though some people claim that these ingredients have actually helped them. So I would not categorically rule them out. That's the vitamin E and almond. If they have helped you, please comment in the comment section so that we would all know if it's helpful to certain people. So I would actually say that you can decide to try them out and see if it's great for you to use as a precautionary measure. But I actually know that some people have actually said to me that, oh, Nursekelly, I have used shea butter and shea butter helped my stretch marks. I cannot categorically say that it's a yes, because your experience with treatment of stretch marks may not be some other person's experience and how they actually helped to resolve or to control their stretch marks. Topical retinols, like I mentioned earlier. Before you use topical retinol creams, please consult your aesthetician, dermatologist, aesthetic nurses, so that there's going to be a guidance. I said earlier that you can't use it in certain areas of your body, so use with caution, because retinols can cause thinning of the skin. It can also cause irritation. Hyaluronic acid and Centella aesthetica, right? They help to keep the skin hydrated and moisturized. So the most important thing with preventing stretch marks, or with helping to reduce the ones that you already have, if you don't want to go for these other treatments that I have mentioned, is to moisturize, hydrate the skin, keep the skin moisture at its highest level to be able to retain moisture to the skin. So these things can actually prevent you from developing more stretch marks and also help to reduce the appearance of the stretch marks that you currently have. We've come to the end of this video. If you have more questions related to stretch marks, please leave them down on the comment section. I would respond to them as much as I can. Don't forget to like this video, don't forget to share this video, don't forget to subscribe to this channel and join the community, and also help to encourage me to post more skincare related content, aesthetic content, nurses content, and obviously lifestyle content. I will try to be consistent on this channel. Thank you guys for the support. You can also decide to follow me on social media platforms showing right on your screens. I'm on TikTok, Instagram, and also on LinkedIn. Bye guys.